Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be doing another Kahoot, and I'm going to be going over neurocognitive deficits. Now, before we get started, as always, I'm going to ask you to please support me and support this channel. Like this video, you're going to love it, so press that like button now so you don't forget. Subscribe to my channel if you haven't done so already, and don't forget I'm now offering next generation NCLEX reviews, one-on-one counseling sessions, and tutoring sessions. You can reserve your spot by going to my website right now, nexusnursinginstitute.com. Well, not now, you're about to do this Kahoot, but afterwards, nexusnursinginstitute.com. And while you're there, be sure to check out the audio lessons that are available. Also, almost daily, you can find me covering a variety of nursing topics across my social media platforms, such as TikTok, Instagram, and Facebook. Without any further ado, guys, let's get started. Neurocognitive deficits. Which assessment finding would be an indication of mild to moderate delirium, disorientation in time and place, impaired abstract thinking, disturbance in memory, or changes in personality? Which would be an assessment finding that you would find in someone that has mild to moderate delirium? Okay, very good. Most of you guys answered correct, same as the live. Disorientation in time and place. So this patient who previously was oriented, they knew who they were, they knew the date, they knew where they were. Now, all of a sudden, they're disoriented to this, okay? Let's talk about big differences between delirium and dementia so you guys do not get them confused. When it comes to delirium is something that's acute. It comes on right away, right? Delirium has an underlying cause. And once that cause is resolved, the patient's not going to be delirious anymore. They're not going to have that confusion. So for example, a patient was previously awake, alert, oriented time 3. All of a sudden, they think they see their grandma flying across the room. They are delirious. They are out of touch with reality. This happened very suddenly. If it's an older patient, what's the first thing you're going to suspect? Infection. Maybe that patient, most likely, they have a UTI, right? So you do that urinalysis, you see bacteria or nitrites or, RBCs, leukocytes. In the urine, you see protein, all of things which should not be in the urine. You see this patient has a UTI. That patient gets antibiotics. All of a sudden, that confusion has cleared up. That is what is known as delirium. Delirium is short-term. It should be short-term. It's acute. It comes on suddenly, and it has an underlying cause. As soon as that underlying cause is resolved, boom, patient's not delirious anymore. Let's talk about dementia. Dementia is the opposite. Instead of being acute, coming on suddenly, dementia comes on slowly. It comes on quietly. It's what's known as insidious. It kind of sneaks up on you, right? And remember how when I talked to you about delirium, I said it has an underlying cause. As soon as, that underlying cause is resolved, the patient's not confused anymore. It's what? Reversible. Delirium is reversible. You just have to treat the underlying cause and it's reversible. Guess what? Dementia is not. Dementia is what's known as progressive. That means as time goes on, it only gets worse. There is no cure. Okay. And so those are the two biggest difference between delirium and dementia that you absolutely need to be aware of. Thank you I see you guys liking the live. Thank you. Select all that applies. You're explaining the neurocognitive decline that's seen in Alzheimer's disease. What examples would you add to your explanation? And here are your choices. Feeling of impending doom, forgetting that food was on the stove, becoming lost while walking down the person's own street, being unable to write or sign their own name, beginning to fear being in public spaces, being unable to understand new information. Which clinical manifestations would you include when you're describing, your typical patient with Alzheimer's disease that's having neurocognitive decline? This is a select all that applies. So remember, you're going to have more than one answer. Okay, let's talk about it. So, Alzheimer's is a type of dementia, okay? And neurocognitive decline. Just break down that word. When you see these big words, don't let them scare you. Just think about it. Neuro, brain, cognitive, cognition, how you think. Okay? So, what signs and symptoms would we expect to see? Let's go through each of them. The feeling of impending doom, no. No. When a patient has a feeling of impending doom, they have that feeling. They don't know what's wrong. They know something's wrong and they feel like they're going to die, right? So a patient with a myocardial infarction, a patient with pulmonary embolism, they have that feeling that they're going to die, but they don't know what's wrong with them. But that's not a sign and symptom you'll see in Alzheimer's. Forgetting food is on the stove. Yes. They'll start cooking and they'll forget that they were cooking. That forgetfulness, yes. Becoming lost while walking down the street. Their own street, yes. What happens with a patient with Alzheimer's, things that were always very familiar to them, all of a sudden, they start to forget. They cannot recognize. Being unable to write their own name. Yep. They'll even forget what their name is. Being scared of being in public places, no. That's a phobia. I want to say agoraphobia, but I might be wrong. Guys, on the live, what is the fear of being in public spaces? I'm having a brain fart. Is it agoraphobia or is it something else? Fear of being in public spaces. Anyone know? Okay, I was right. Agoraphobia. That is the fear of being in public spaces. That's not Alzheimer's. That actually falls under the anxiety umbrella. Okay. And last, unable to understand new information. Yes. Not only are they having a hard time remembering past information, they have a hard time processing new information. So forgetting food that was on the stove, forgetting, how to even get home, forgetting how to write their name or their signature, being unable to understand new information, all of those are signs and symptoms of Alzheimer's, which again is a type of dementia. True or false? Degeneration of the cholinergic system is associated with the development of Alzheimer's disease. Is this true or is this false? Excuse me. It's true. Here's the thing. To this day, it's 2023 and we still do not have a 100% known cause. We know risk factors. We know things that can increase the risk of it, and we don't have a cure, right? But we know things that are definitely increases the risk, and we know things that are associated with Alzheimer's. And one of the things we know for sure that we've seen research has shown is that those enzymes that create the acetylcholine is severely diminished in the patients with Alzheimer's disease. So there absolutely is a degeneration of the cholinergic system in the patients with Alzheimer's. Select all that applies. Your patient has delirium. Which nursing interventions are appropriate after a safe environment has been established? Select all that applies. Because remember, first, you got to make sure your patient's safe before you do anything else. But after you've made sure your patient's safe, which is important nursing intervention? Select all that apply. Here are your choices. Talking about self-care needs, offering recreational activities, providing a structured environment, instituting measures to promote sleep, allowing the patient to roll the halls, or Professor D, I have no clue at this point. I give up. What do you guys say? What do you guys think on the live? What do you think the answer is? Okay, so let's talk about this. The signs and symptoms, nursing interventions for a patient with delirium. Remember, delirium, Short term, hopefully, reversible once we find that underlying cause, where dementia is long term, it's chronic, it's progressive. We're talking about a delirium. What are we going to do for our patient? The first one that says talk about self-care needs. False. They have delirium. They are not in touch with reality. What kind of self-care needs are you going to be teaching this patient? You're wasting your breath. False. Next, offer recreational activities. Absolutely. That patient is out of touch with reality, and we don't want them just sitting there in the bed all day being delirious. So we're going to be offering them different types of activities. Even though they have this delirium that's happening, physically, we want that patient moving about. Providing a structured environment. Absolutely. This helps with the delirium. I always say your patient that has delirium, that has dementia, in many ways, you kind of treat them. If you guys have taken pediatric nursing, you kind of treat them like the toddler. You know, when they're getting in something they shouldn't, you don't tell them, hey, stop that. You don't get on them. What do? All you got to do is distract them. You just be like, hey, look over here, and you give them something else to do. You want to provide a structured environment, institute measures to promote sleep. Yes, because if they're delirious, do you think they'll be sleeping much? No. Guess what? Sleep is part of physiological integrity. Before I started this video, for everybody that was on the live, I was giving you tips on how to pass HESI. What was one of the things I told you about physiological integrity? Everything that falls under it. Your fluid and electrolytes, those vital signs, dehydration, nutrition. Guess what else falls in their sleep? Patient doesn't have enough sleep, they will crash. That is very important. You want to promote sleep measures. Look at what else is on that list. Allowing the patient to roam the halls. Absolutely not. That's not safe. And why are you going to let them roam the halls, bothering other people? Absolutely not. We want our patient in a safe, structured environment. Your patient has dementia. Which intervention will help performance of ADLs? Is it have the patient perform all basic care without help? Tell the patient that morning care must be completed by 9 a.m. Give the patient a written list of activities that are expected to be completed, or encourage the patient and give them enough time for basic tasks to be completed. Good. Most of you guys got it right. You're going to encourage them and give them enough time. This is um this is a constant in nursing. You always want the patient to do as much for themselves as they can, and you are always going to promote that independence. You do not step in until they can't do something, then you assist them, but you always want them to do as much for themselves as they can. Patients with neurocognitive or even neuromuscular deficits, you have to give them time. So that patient that has Alzheimer's, it's going to take them longer to get dressed, but you're going to encourage them to dress themselves if they can. Just like a patient who just had a stroke, right? You want to promote their independence. You want them to get dressed themselves if they can. You just have to allow them more time to do that. If you don't, you're going to cause them to be frustrated. They're going to want to give up. And it really doesn't help the nurse patient therapeutic relationship because they're feeling rushed. True or false? Vascular dementia is caused by a series of small strokes over a long period of time. Is that true or is that false? What do you guys think? Very good. It's true. It is true. So over a long period of time, the patient has these mini strokes, and what happens is it causes damage to the brain tissue. So what do you think? What do you expect to happen? The patient's going to start to have this cognitive decline. Absolutely. Which nursing intervention would help your patient with memory deficits function in their environment? Would it be to help them do simple tasks by giving them step-by-step directions? Would it be to avoid frustrating the patient by performing the simple tasks yourself? Would it be to stimulate the patient by introducing new topics daily? Or would it be to firmly urge the patient to remember tasks? Which intervention would help with memory deficits and for them to function in their environment? Okay, very good. Help the patient do simple tasks by giving them step-by-step directions. Let me explain what I mean by step-by-step. If the patient has to brush your teeth, you cannot say to the patient, I want you to pull out your toothbrush, put the toothpaste on the toothbrush. I want you to wet the toothbrush and then brush your teeth. You have to say to the patient, I want you to pull out your toothbrush. They pull out the toothbrush. I want you to put toothpaste on your toothbrush, then they do that. Then you tell them, I want you to wet your toothbrush, then they do that. Then you tell them, I want you to go across your teeth with the toothbrush. That's what I mean when I say step-by-step directions. So you're empowering them to be independent. You're empowering them to do things for themselves, but they need those step-by-step directions. If you give them directions 1, 2, 3, 4, 5 steps in a row, it's too much for them to follow. Remember, they have what? Neurocognitive decline. Look at the other choices. Avoid frustrating the patient by performing simple tasks yourself. If you do the task for the patient, how are you promoting independence? You're not. Stimulating the patient by introducing new topics. Remember what I told you about that dementia patient? Remember, they have a problem remembering things that were familiar to them, remembering their own name. How do you think they're going to handle new topics? So that's not going to help them by introducing new topics daily. Absolutely not. And last, look, first of all, the first word, when it said firmly, you should have known it was wrong, but let's keep going. Firmly urge the patient to remember tasks. This is a disease. This is their disorder. You could firmly encourage them to remember as much as you want. It doesn't mean it's going to happen. This is part of their disease process. Select all that applies. You've just given Haldol to your dementia patient. You'd be alert for which adverse reactions. Select all that applies. Here are your choices: photosensitivity, bradycardia, urinary output, skin irritation, insomnia, and dizziness. I will give you a hint. This medication, Haldol, you better know it for NCLEX, I'll tell you that much. But anyway, Haldol, this is an antipsychotic. That's the drug class. So you just gave your patient Haldol. Which adverse reaction would you be watching out for? Photosensitivity, bradycardia, urinary output, skin irritation, insomnia, or dizziness. Select all that applies. Okay, let's talk about it. When it comes to Haldol, adverse effects you'd be concerned about is photosensitivity, that skin reaction when the patient's out in the sun. You'd be concerned about urinary output. And let me be more specific. When it says urinary output, but more specifically, the adverse effect that you would see with Haldol would be urinary retention. Okay. And the last one is dizziness. Another adverse effect that commonly you'll see as a test question for Haldol is drowsiness. So the patient's taking an antipsychotic, you're going to warn them not to operate heavy machinery because it can cause dizziness and drowsiness, and safety is a very important factor. True or false? A patient with dementia will have difficulty with long-term memory. Is that true or is that false? True. Wait, a patient with dementia, false. That is absolutely false. You know what? I don't like the way this was worded because I know how you guys were thinking. Let me explain this to you. Patients with dementia, they have a problem with memory. Absolutely. Their long-term memory is more intact than the short-term memory. So what we'll see is they'll forget, they may forget their children. They may forget their address. They may forget what they ate yesterday, but they'll remember a song from the 1950s. They'll remember a song, or they'll remember something that they did as a child or someone that they knew as a child. Now, eventually, depending on how long the patients had dementia and what stage of dementia they're in, they'll even forget that. If they live long enough, they can get to the point where literally they will see a toilet, They'll see water in the toilet and they don't even know what the toilet is. Matter of fact, it could be so bad if the dementia has progressed to that point that they'll see a glass of water and they haven't drank water in days and they're thirsty. Physiologically speaking, they are dehydrated and they see the water, but they don't recognize that the water is to drink. Okay, so this was a tricky question. So the correct answer is false, and that's just because for testing purposes, you're expected to know when it comes to the dementia patient, they'll forget things closer to the now, but their long-term memory, things that happened a long time ago, tends to be more intact. And that's why, what is the name of that? That's why the patient who are like on the dementia unit, there'll be music therapy and they won't play music that, is hot now. They'll play music that, was hot when they were younger, when they were teenagers or adolescents or children, because they'll be able to reminisce and they'll be able to remember from a long time ago. So this was actually a tricky question, but I hope I explained it well enough for you guys to understand. An elderly patient has memory and attention deficits that have developed over a 3-day period. These symptoms are characteristic of what? Would you say Alzheimer's disease, amnesia syndrome, delirium, or dementia? Very good, delirium. Remember, delirium is acute. It happens like this. It happens suddenly. Where dementia is insidious, it happens very slowly. So the fact that we saw this this happen within 3 days, we know it was a quick onset. So let's talk about this. Alzheimer's is a type of dementia, so we know that's going to be slowly progressing. Amnesia syndrome. This is where the person, it's whenever you see that word syndrome, by the way, that just means cluster of signs and symptoms that lead to a disorder or diagnosis. So amnesia syndrome is where the patient is forgetful. They forgot things due to something, and usually it's due to something such as a trauma. They got in an MVA and there was trauma to the brain, and so they'll forget. But if you look at the question, it doesn't only say memory, it says memory and attention. The patients that have amnesia syndrome, they may have deficits in memory, but not attention. So that can't be the answer. And then, of course, dementia. Again, dementia is progressive, it's long-term, it's insidious. So the correct answer for this question would be delirium. Which age group is at the highest risk for developing delirium? Would you say it's children, adolescents, middle-aged adults, or the elderly? Very good. The elderly. The elderly. Let's talk about this. Why? The biggest reason that we tend to see delirium in the elderly, here's the thing. The older that you get, the longer that you lived on this earth, is just wear and tear on the body. So your kidney's not working the way it used to, and your liver's not working the way it used to. Your kidney's responsible for the excretion of toxic waste, right? Your blood gets cleaned out and all that toxic stuff from your blood turns into urine, right? So the kidneys are responsible for excretion, and when you take meds and the meds get broken down, it needs to get out your body, it goes through what? The urine. So you have kidney breakdown in the elderly, and what else? Liver breakdown. Is just wear and tear of the body. The liver's not working the way it used to. Guess what the liver is responsible for? Metabolism of the medication. So if you're not breaking down these meds and metabolizing them the way you're supposed to, if you're not getting rid of these meds the way that you're supposed to, you're going to get what? It's going to accumulate in your body. And the accumulation of those meds absolutely can cause delirium. And as I said before, infection in an adult, such as a UTI, one of the first signs and symptoms is what? That sudden confusion, that delirium. True or false? If your patient's having a hallucination, it is best to argue the reality to assist them in the reorientation process. Is this true or is it false? Very good. It's false. So I need you guys to do me a favor. Everybody in the live right now that is watching, I need you to type in the one word in that whole question that made you know it was false. What was the word that made you decide this is false? Come on now. That's right. Argue. Do we ever argue with patients? Absolutely. You do not enter into what's known as a power struggle with a patient. You don't argue. The minute, if you see a test question and you see argue, you know that is incorrect. Very good. Which type of hallucination, if observed in your patient, would be most concerning to you, the nurse? Would it be command hallucinations, visual hallucination? Would it be an illusion or a delusion? Which one would be most concerning to you, the nurse? You guys are doing great on the live. I see you know the answer. Let's see how you're doing in the classroom. All right, guys, what do you say? Very good. Command. When a patient has command hallucinations, those voices in their head are telling them to do something. They feel compelled to do whatever the voices are telling them to do. They cannot help it. If that voice tells them to punch you in your throat, guess what that patient is going to do? They're going to punch you in the throat, or at least they're going to try. They cannot help it. So any patient that has command hallucinations, this is a very dangerous situation. And if you are the RN and you have to pick assignments, you're going to give a seasoned psychiatric nurse that patient, because they have to, be able to assess the patient well and see if there's any issues that need to be addressed. Now, let's look at the other choices. Visual hallucinations, that's a type of hallucination that you see with your eyes. You're seeing something that's not really there. What is an illusion? Well, guess what? An illusion, there's something that's there. Your perception is off. That is the difference between a visual hallucination and illusion. A visual hallucination, you're seeing something that's not there. There's absolutely nothing there, but you're seeing something. An illusion, there actually is something there, but what you're seeing is not what's really there. So what your what's the word I'm looking for? Your perception, that's the word I'm looking for. Your perception of what's there is incorrect. That's your difference between a visual hallucination and an illusion. What about delusion? What is delusion? A delusion is a false thought, a false belief. Okay? Select all that applies. Your patient has impaired memory and judgment. Which nursing intervention should be implemented? Select all that applies. So your patient has impaired memory and judgment. Here are your choices. Perform all ADLs for the patient. Speak slowly and in a normal tone. Keep playing music to promote environmental stimuli. Apply ample time for the patient to respond to questions. Reorient the patient as needed during the course of the day. Approach the patient from the front when you're beginning a conversation. What nursing interventions would you use with this patient that has an impaired memory and judgment? Okay, so let's talk about the correct answers. We'll talk about the correct answers first, and I'll go over the wrong ones. Speaking slowly and in a normal voice. Yes. Why? Because their memory, their judgment is impaired, their thinking process has slowed down. So you don't want to speak very quickly because they might not catch what you're saying. You want to speak slowly, but in a normal tone. Don't yell. They're not deaf, right? They've got neurocognitive deficits, but they're not deaf. So you want to speak slowly, but in a normal tone. You want to apply ample time for them to respond to your question. So not only are you going to speak slowly in a normal tone, pause, give them enough time to formulate their thoughts so that they can answer any questions that you have, or if they're having a conversation with you, allow them time to formulate their thoughts. Remember, the cognition, they have cognitive deficits, their thinking has slowed down. Approach the patient from the front when you're having a conversation. Why? You want to face them while you're talking to them. You want them to look at your body, your facial gestures, your body language, and you don't want to scare them. You don't want to approach them from the back. So you're going to start a conversation facing them, and you want to orient the patient as needed during the course of the day. Remember, this is a disorder that's what? Progressive. What does progressive mean? That means as time goes on, it only gets worse. So you're going to have to keep reorienting them. Okay. Now, the two wrong answer choices: performing all ADLs for the patient. I can't believe 9 people chose this. After I told you that in nursing, we want the patient to do as much for themselves as possible. The only time we want to step in is, excuse me, when they can't do something for themselves. So why would we perform all of their ADLs for them? We want them to be independent. And the other wrong answer is, look at this, keep playing music to promote environmental stimuli. 18 people chose this. Let me tell you why this is wrong. The first word, keep. What is that word? When it says to keep playing music, that means ongoing, not intermittent, not once in a while, right? Ongoing. I don't have neurocognitive deficits, and I'm not trying to hear music all day and all night. That's going to drive somebody crazy. That's torture. So that word keep, that's what should have made you say, wait a minute, that's wrong. Because that keep music playing all day, all night, going, that's torture. Absolutely not. All right, guys, one more question. Last question. Select all that applies. What history would you expect to see in a patient with dementia? Select all that apply. Slow progression of symptoms. The patient admits to feelings of sadness. The patient is pessimistic. The symptoms appear suddenly. They have a noticeable change in their personality. The patient's often apathetic. This is a select all that applies. So which history would you expect to see in that patient with a history of dementia? Slow progression of symptoms, them feeling sad, them being pessimistic, the symptoms appearing suddenly, noticeable changes in the patient's personality, and the patient being often apathetic. Okay, so let's go over the correct answer choices first when it comes to dementia. Slow progression of symptoms. I'm so happy 71 of you guys chose that, because yeah, remember, dementia is slow, it is insidious, it is progressive. Noticeable changes in personality. Yes, something else we see with the patient with dementia as they start to decline. Many patients with dementia, you'll see a change in their personality. Many patients, not all, but many patients may become more aggressive. You'll see a change in their personality. Let's look at the wrong answer choices. Them being sad, them being pessimistic, them often being apathetic, having apathy. Those are signs and symptoms of what? Depression. Not dementia, depression. And the last wrong answer choice, the one that says symptoms appear suddenly, you see that in what? Delirium, not dementia. You guys did a wonderful job. All right, let's see how you did. Okay, guys, thank you for watching. Please let me know in the comment section what you thought about this video and what you'd like to see me cover next or more extensively. Also, let me know what format you'd like to see it in. Would you like it in activity format such as this Kahoot? Would you like it in a lecture format where I'm teaching out of the book? Or would you like it in a QA format such as the videos that are published every Sunday, 1 p.m. Eastern Standard Time? Don't forget, guys, I'm now offering next generation NCLEX reviews and one-on-one tutoring sessions. You can reserve your spot right now at nexusnursinginstitute.com. Thank you so much for watching, guys, and you guys can catch me on the next video.